Welcome to the Peds NP, Pearls of Pediatric Evidence-Based Practice. I'm your host, Dr. Becky Carson, pediatric nurse practitioner and clinical assistant professor at the Catholic University of America in Washington, D.C. I am so excited to welcome you to the first episode of the Peds NP Acute Care Faculty Series. This is a very special series that was written by a team of acute care PNP faculty from across the country. Each episode will address common issues experienced by acute care PNP students as they enter clinical. So it's especially for acute care PNP students by their own acute care PNP faculty so that you can take better care of kids. These pearls of wisdom written by our star-studded, nationally renowned faculty represent a practical approach to common clinical conundrums founded in the scholarly literature that are useful to anyone caring for children in a variety of acute care settings. This series also took a novel approach to peer review to guarantee the quality of the content you're listening to. As we discuss the given topic, we'll help you build functional skills in a conversational way that can translate to your competency-based education. When we focus on bringing the didactic to life in the podcast, so how to do a skill rather than what to know, you'll be better prepared to apply these concepts in clinical, master a new skill set, and meet the goals of your acute care PNP education, regardless of your clinical setting. This series is especially awesome because the faculty who wrote it are experts in their fields, and we were able to breach the boundaries of time and geography to bring you their professional guidance on how best to build your skills. It's also valuable that through collaboration with acute care PNP faculty who span the spectrum of acute care pediatrics, from the emergency department to the intensive care unit, inpatient floor, and subspecialties, we can bring you the best teaching tools from providers who practice these skills clinically every day. The best part of it all is that I got to work with my friends who are brilliant and incredible educators. In this episode, I had some wonderful co-authors, Dr. Danny Siebens from Arizona State University, Dr. Brittany Christensen from the University of California at San Francisco, Dr. Priscilla Reed, and Dr. Julie Kuzin, both from Texas Tech University Health Sciences Center. We hope that you're listening to this episode before you even set foot in your clinical rotation. But if you've already got some hours under your belt, there's still plenty to learn, and it's never too late to course correct and make a change to your practice or improve your professionalism. After all, isn't that what you're here for? To take practical knowledge with you that will shape you into a better provider? We sure hope so. Let's get started. So you've gotten your first clinical assignment and the green light that all your preclinical requirements have been met. Now what? Before you even step foot in the hospital, let's talk about a very real phenomenon that you may have experienced without even realizing it: imposter syndrome. The term imposter phenomenon was first coined in 1978 to describe a feeling of intellectual phoniness that seemed to be prevalent and intense among high achievers in various professions. We feel like imposters, afraid of being inadequate or viewed as a fraud when we enter a new role, like transitioning from a bedside nurse to a nurse practitioner. Identified among nurses in particular is the awareness that at some level, we believe we don't really deserve to be regarded as competent individuals, despite years of experience and apparent success in the nursing profession. Sound familiar? Here's a secret. You're not alone. One single-center study on master's and doctoral students found that 88% of students surveyed experienced moderate to severe imposter phenomenon. And many of the highly accomplished faculty who developed this podcast series expressed that we still experience imposter syndrome quite often. The feeling of being an imposter can be troubling and may be triggered by being evaluated, which happens constantly in graduate school, right? It's normal to sense some degree of discomfort during an NP clinical rotation. My high school track coach always told me it's okay to have butterflies. You just have to learn how to make them fly in formation. We encourage you to recognize this feeling and reframe the sense of being an imposter. Acknowledge the new phase of learning and honor the strength of your knowledge base. Do you remember your first day as a nurse? I remember mine. I struggled to pop the lid off a vial, attach a needle to a syringe, and draw out a medication. Something I can now do one-handed while simultaneously holding pressure on a bleeding wound with the other hand. Think about how much you didn't know then and how much you know now. Oh, the places you'll go. You can anticipate growth in your assessment skills, your clinical judgment, diagnostic reasoning, and management of pediatric conditions over the course of your program, if you embrace the role of learner, rather than treating it as an uncomfortable voyeurism into your future occupation. There is real truth in fake it till you make it, and then one day you'll realize you made it. So what happens if your preceptor grills you and you feel dumb about not knowing the answer? Well, first, don't panic. You're not dumb and you can prove it. My son reads a book about going to kindergarten that teaches him you aren't supposed to know the things you haven't learned yet. This clinical rotation is your exposure to the NP role through the lens of a specific specialty, in apprentice with a clinical expert. What's important is to identify your current knowledge and the gaps. Express to your preceptor what you do know and ask another clinical question back to them. Let's say your preceptor asks you what antibiotic you want to use to treat cellulitis, but you don't know the answer. Share what you do know and flip the question back on the preceptor. That's a tough question. This infection looks severe on exam, and we should admit for IV antibiotics so we can do serial exams. I guess we would need to cover common skin flora, but I'm not sure which IV antibiotic would be the best choice for gram-positive coverage and coverage for MRSA. What are our options in this community? Wow, I can work with that and teach you the next steps of medical decision-making. Conversely, you can also acknowledge the gap in your knowledge and ask for 5 minutes to look it up. You're expected to know your resources and be an enthusiastic learner. Your preceptor will appreciate the initiative to seek out the answer instead of relying on them to be a gumball machine for answers. Keep an open mind and be brave, and you'll see that you can actually walk and chew gum at the same time. But realize that it's not going to be an automatic A handed to you on a silver platter. If you want to be a pediatric nurse practitioner, you have to put in the work. Now that you're as confident as Taylor Swift on stage at an open mic night at your local Starbucks, let's take a step back to discuss communication and professional etiquette. Most likely, your first communication will be through email. This is not your BFF arranging brunch plans. This is your current clinical boss, so keep formality with greetings like good morning rather than hey. Introduce yourself and your nursing background relevant to the clinical rotation, kind of like a passport of where you've been in nursing. Something like, I've been a pediatric ICU nurse for 3 years and completed 200 hours in primary care last semester. I also volunteered on a mission trip to Peru last summer where I helped with Operation Smile. This is my first acute care rotation, and I often care for children with oncology diagnoses in the PICU, but outpatient management is more unknown to me. This is also a good time to share your syllabus, clinical goals, and number of hours that you need for the rotation. When you conclude your email, include a signature line and designate who you are, your credentials, and affiliation. For example, Olivia Jones, RN, BSN, CUA Acute Care PNP, graduate student. If you begin texting later on, show similar professional courtesies and respect for the time of day. Just because you're awake doesn't mean everybody else is. And the first text should be your name. A cold call from an unknown number is likely to get sidebarred and sent straight to voicemail. Now that you've established a communication pattern, keep it professional from here on out. Your clinical rotations are an unofficial extended job interview. This site might be your future employer. The pediatric world, especially in peds acute care, is small, very small. And people talk. If this rotation is not your preferred area for future practice, Don't let that reflect in your behavior and attitude, because word of your poor initiative and investment will likely travel like wildfire. You're not only representing yourself for future job opportunities, but also your school and future students who'll do rotations there. All right, the schedule is in and you're all set up for your first day. You've got 2 shifts per week on the books, which should be plenty of time for you to complete your schoolwork, your PRN nursing job, and keep some semblance of a social life. Sounds like a plan to me. Getting a couple of days in a row can be great for continuity of care and learning how to take on the role. But as you schedule your work-life balance, remember that while you're a student, those clinical hours have some unspoken supplemental pre- and post-homework that won't count towards your hours. You need to study before clinical because there are undoubtedly diagnoses, management plans, and complex patient presentations that will be unfamiliar. You'll need to review the schedule or census, show up early to pre-round alongside your preceptor, and go home to read about the choices you made after clinical. That time to reflect is essential because the mental load of being a novice PNP is much different from your role as a bedside nurse. Everything is new, and that leads to more brain drain and physical exhaustion than your work as a nurse. You probably nodded along with some complex discussions during rounds that went right over your head. You need to go home and take it back to the patho to understand why we do what we do. That kind of post hoc studying will help solidify the content and build your skill in medical decision-making because you supplemented the experience with the literature. Okay, you're all set. You've emailed with your preceptor, studied up, watched the instructional videos, reviewed your pre-rounding in the chart, packed your lunch, and loaded up your book bag with Harriet Lane and your stethoscope. Your phone is updated with new apps like Hippocrates, UpToDate, Doximity, and the hospital's electronic medical record app. Sidebar: remember to treat your phone like a genital exam. Excuse me? Yep, you heard me. Tell your preceptor exactly what you're doing on your phone before you do it, so that they're aware of how you're using point-of-care mobile information to support your learning, rather than death scrolling social media on clinical time. All right, you went to bed early and had a Christmas Eve kind of sleep because you were so excited for clinical. The alarm goes off and you leap out of bed. What will you wear? The answer to that is a balance between the expectations laid out by your school and your clinical site. Know your audience. If white coats are a thing, wear one. If scrubs and fleece jackets are the norm, you're welcome to don them. Whatever you wear, it should be free from insignia or branding other than your graduate school or the hospital where you're in clinical. If you have embroidery that labels you as an RN for a certain unit, you probably shouldn't wear it so that your role is not confused. Dress for the job you want, not the job you have. Your appearance has a lot to do with your identity and confidence. Be you. But again, know your audience. This is probably not the place to wear anything dangly. Make sure your hair, jewelry, and dress is suitable to keep a sterile field if necessary. It's an unfortunate but true comment that implicit bias can play a major role in how you're perceived in a clinical setting. So err on the side of conservative in adherence to school and hospital policies that will help you highlight your professionalism. Okay, you open up the closet, and while you're picking out the clothes, I want you to think about the patient population that you'll serve and what your implicit biases are. Have you taken a Harvard Implicit Association test to better understand your implicit biases? I want you to prepare yourself with the kind of empathy and allyship that is desperately needed in pediatrics. You can do it every day as you prepare yourself to care for our nation's most vulnerable population. As you put on your socks, consider whether you're going to be in an urban setting with patients whose health disparities often lead to inequities. As you look in the mirror to fix your hair, ask yourself, how will I overcome those barriers? When you brush your teeth, think about, How can I be their ally? When you put on your glasses, decide how you will use a lens of health equity to guide their care. And when you pin your name badge to your shirt, ask yourself whether your patients and their families will see their values reflected in your care. Okay, I think you're ready. Finally, you're there. Clinical. Where do you put your things? Where does your lunch go? Can you drink water in the workstation? Where is the bathroom? I know it's anxiety-producing to be new, but it's okay. You're an adult, and you're not going to spend the next 100 hours of your rotation not knowing where the bathroom is. Your preceptor is an angel who has volunteered to teach you how to become a PNP, and they will certainly help you take care of all of your human needs. Just remember that you're a guest in their house. You don't want to be Goldilocks caught in the bed of the mama or papa bear when they need to provide important patient care. But rest assured that as time passes, with your enthusiastic work ethic and strong foundational knowledge, you're going to be an important tool in patient care as well. You won't always feel new. You'll just feel new until you don't. And that's when you know that you've been successful at building new skills and relationships as part of the multidisciplinary team. You got to the unit, you had your tour, and you sit down to pull out the patient list. And your preceptor asks you, what do you want to learn on this rotation? Everything? Well, everything is a bit lofty of a goal. Let's narrow it down. The syllabus gives you course goals and objectives, and you remember that your professor gave the preclinical assignment to create personal objectives, all based on how you would like to grow. Bloom's taxonomy verbs help give you measurable, high-level, and specific objectives. These goals often speak to your identified areas of improvement and are highly focused. Things like learning of a particular disease state, history or physical exam proficiency, medical decision-making, confidence in the relationship with families, presentation of a patient, or anything else that falls into your scope as an NP on this rotation. It's smart to use SMART goals. This stands for specific, measurable, achievable, relevant, and time-bound. That way, when your goals are framed around these features, you can actually check the boxes of achieving them and see the progress you made in the allotted hours of the rotation. Objectives are how you're going to accomplish those goals. So after a few moments, you answer, by the end of this rotation, one of my goals is to compose a one-liner summary statement on all of my patients independently. I'll do this through synthesizing the history and physical exam using transformative language. Another goal is to develop the patient's problem list, differential diagnosis, and treatment plan with some guidance. I'll do this through systematic consideration of the differential and using my resources in evidence-based practice to select management plans. What wonderful goals! Your preceptor is beaming and is so excited for you to join the team. Remember that as a guest in their house, your professional responsibility extends beyond being polite and friendly to other staff members into being an enthusiastic learner. Stay engaged. It's really easy to mentally drift when the mental load is heavy. Take notes, be mentally present during rounding, use engaged body language. So lean in, use eye contact, open up your shoulders. Be a good steward of your preceptor's efforts. Remember, there's a job to do and patient care comes first. Ask only informed questions at appropriate times after doing your own research. We hear complaints all the time about students who just fill the silence with, just out of curiosity. Remember that clinical is about doing, not watching. So it may be helpful to keep a post-it of pointed questions for the end of the day so you don't soak up valuable patient care time, but you're clear about the studying that you're going to go home to cement. Let's talk a bit more about role delineation, especially when your clinical is on the same unit where you work as a nurse. Be careful to stay within the boundaries of an NP student when you're present as a graduate student in clinical. That's one reason that wearing different clothes and wearing your graduate name badge is so important. Don't backslide into the RN role or bounce over to help your friends when things get busy. That could put you in some serious medical legal liability. Let's listen to an example. You're on a rotation in inpatient pediatrics, and one day there's a really tough case of a patient that needs a nasoduodenal tube. But the nurses can't get it in, so they ask your NP preceptor to help them. You have a secret superpower of placing ND tubes, and you're interested at taking a stab at it first. That's appropriate. Conversely, now imagine you're rounding with the infectious disease team on your home unit when you see your colleagues struggling to place that ND tube, and you happen to be walking by, so they ask you to give it a try. You backslide into the RN role and slip in the tube without difficulty. You scurry to catch up with rounds and flip right back into your NP student role without missing a beat. Sounds like a win-win situation, right? Wrong. No one remembered to have the provider evaluate the KUB and write an order that it's okay to use the ND tube for feeds. Oops. You placed it in the lungs, and the bedside nurse infused formula into the lungs for hours. The next day, you arrive at work in your RN role and discover the patient was transferred to the PICU overnight. Who put in that tube? You did. But you weren't supposed to be there as an RN. And the ID nurse practitioner had no role in that bedside procedure. Placement of the ND tube on that patient wasn't covered by your NP student role that day. Who's responsible? Does the hospital have liability? Does the school have liability? Either way, patient harm occurred and you were the source. Unfortunately, that story is true. Don't put yourself in that position. Don't function as a nurse just because you're more confident in those skills. Your nursing practice will inform your advanced practice, but stay in your lane. Another pitfall we should address is HIPAA compliance. Failure to adhere to regulations means that you could fail your course, or worse, be dismissed from your program. Remember to treat all scratch paper with your notes, your login to the EMR, and your student tracking system like Typhon or In Place as PHI. Log out, place paper in shredders, and turn in any assignments without identifying information. Okay, so you've logged out, pushed in your chair, and you're leaving your last day of clinical. The staff loved you and wishes you well. What do you do next? Be thoughtful in how you show the grandest appreciation possible to your preceptor. Nurse practitioner programs do not typically pay preceptors, an issue which is very hot in leadership circles. That means that your preceptor is an absolute gem of a human being, a true visionary for the future. Someone showed them the same kindness in clinical education, so they pay it forward to you, selflessly investing in the next generation of PNPs. Say thank you in a heartfelt card. Bake your famous chocolate chip banana bread for the staff. And leave a little parting gift that's kind and thoughtful, but could not be mistaken for coercion for a good evaluation. You don't want the preceptor to think that you're buying your good grades. I always enjoy putting up the Christmas ornament I received from my first PNP student each year, and I like to think about how many children that student has helped. You can do this. You are well prepared for this experience. Embrace the student role. Use the opportunity to put yourself in the hot seat. You have a safety net, your preceptor. When a provider asks, "Does anyone know why we treat this pathogen with this medication?" Jump in, speak up, be brave. Sure, your heart is pounding and your mouth goes dry, your armpits get all sweaty, but you're almost positive you know the answer. That fight or flight feeling is temporary. The experience will root this content in your memory. Even if you're incorrect, you'll remember the right answer when it really matters, while you're taking your certification exam, or more importantly, when you're caring for someone's child. I want to thank my awesome co-authors from today's episode one more time. Doctors Danny Siebens, Brittany Christensen, Priscilla Reed, and Julie Kuzin. The episode was peer-reviewed by the Acute Care Faculty Series peer review team. You can read more about our novel and scholarly approach to peer review, review our faculty lineup, and learn more about the series, the competency mapping, references, and show notes at www.thepedsnp.com. There was no financial support or conflicts of interest to report. Follow me on Instagram at the PedsNP podcast. Email me at thepedsnp@gmail.com. And remember, this isn't just a podcast, and you're not an imposter. You're just new. I'm Becky Carson. Take care.